Hello, I'm Dr. Alicia Rosen-Fox, President of the American Clinical Board of Nutrition, also known as the ACBN. Recently, the board met for the ACA's Council on Nutrition Symposium to talk about some exciting new directions for the ACBN to move in. Premier among those directions was raising awareness and participation in the ACBN Diplomate Program, the preeminent certification in nutrition for doctorate-level practitioners. We put some questions to our board members. I think their answers tell an inspiring story of what the ACBN Diplomate can do for your practice, patients, and the way you deliver nutrition therapy. Here are the questions with some of the board members to answer them.
The ACBN, is the American Clinical Board of Nutrition, is a premier organization for certifying competence in clinical nutrition,
which certifies doctors in all degrees
charged with the task of certifying postdoctoral physicians or health providers.
The primary purpose of the ACBN is actually to protect the public.
ACBN has been very helpful in providing a benchmark or standard by which any physician, regardless of what kind of discipline he starts out with, can feel confident in applying clinical nutrition.
The ACBN board serves its certificates in a multitude of ways.
The ACBN is charged with providing a legal, a psychometrically correct examination that is standardized across the board.
It sets standards that tells the general public that these certificates have met these standards.
They're exposed to seminars and speakers who are top-notch in their field.
Ensuring a certain level of knowledge in the field of clinical nutrition.
The applicant that's taking the exam gets a good exam that shows that they are masters of the knowledge that they have.
We hope to actually develop the certificates.
Dr. Gaffney and I are on the examining board. It's up to us to see that our 14-member examining committee construct the exam questions so that they will be approved and qualify as a psychometrician would review it.
Be assured that your knowledge base on clinical nutrition is up to par.
Legally defensible, so we have to have the data and the research behind the question and the answer.
It's designed to keep you from getting involved in things that are not scientifically based or clinically relevant.
We've just kept working with it to get everything together, so we have a 300-hour diplomate to credential doctors that want to be above and beyond.
It's a way to be sure that you're kind of on the top notch of the people practicing clinical nutrition.
I have a great deal of respect for the work that this board has done in the past, continues to do, and I expect will continue to do in the future. It's incredible the effort and the thought and the vision that they've had, and I really appreciate being a diplomate knowing that they continue to do that.
One of the things that drew me to this particular organization was that it crossed the span of healthcare providers.
We are the only agency that does not discriminate to academic degree.
I could be a chiropractor, I could be an MD, I could be a naturopath, I could be an acupuncturist, I could be a PhD.
Many different facets of professions can access it.
That means that any qualified healthcare professional may sit for the exam. So our organization has medical doctors, naturopathic doctors, PhDs in nutrition, chiropractors, naturopaths, and so forth. We are the only organization that is like that.
The American Clinical Board of Nutrition often finds itself appealing to dentists, to neurologists now, to general practitioners, But a lot of the specialty fields, because those are the ones that find themselves inundated with problem cases that often are very, very easily treated using some of the basic principles of clinical nutrition.
The diplomate of the American Clinical Board of Nutrition is not restricted to any particular class. It transcends all professional postdoctoral degrees.
Dentists, optometrists, ophthalmologists. It's important that the eye have the nutrition and the substances that needs to heal or to function optimally.
I think all practices, actually, we have had several dentists that I know are prominently involved with the diplomate program. We have numerous medical doctors, many chiropractors, naturopaths,
Medical physicians, osteopathic physicians, chiropractic physicians, dental physicians, any postdoctoral professional.
and in doing so, they're actually setting themselves together, even though they're divergent professions, in one path of helping people naturally through proper nutrition.
One of the benefits to the patients is that they are definitely assured of a practitioner that knows his stuff. They have been through rigorous testing procedure, and they pass minimal qualifications that you would definitely want in your doctor if you were looking for nutritional advice.
Through rigorous testing and recertification, it does ensure that you're maintaining your appropriate continuing education. So it's a level of protection for the patient.
It helps the doctor because patients are looking for the best, the specialist, and they will seek them out. It allows the doctor who is a diplomate a greater venue, if you will, for their practice, because I find in my practice, for example, people really want nutrition. They may need a chiropractor or a naturopath or a medical doctor, but they want nutrition.
This actually is proof that you have attained a higher level of education in the field of nutrition. It's something which you can promote with your patients. It's something you can promote in the community, holding yourself out as an expert and having proof, not only your own word, but you've got the backing of a nationally recognized certifying agency.
That's saying that you know what you're talking about, and we guarantee that you know what you're talking about. And for any healthcare provider, how can you ask for more than that?
Today, people are looking for a way, looking for people who can provide this information in nutrition in a qualified way. And I think that the ACBN has provided a venue for that, to give people an opportunity to find doctors who have attained a higher level of expertise in the field of nutrition and have a certification which is not a self-serving or a narrow area of nutrition, but really covering a broad area of nutrition which is relevant and important today.
I think you can see why we on the American Clinical Board of Nutrition are so proud to offer this unequal diplomate. As the current president of this great organization, it's been my privilege to talk to doctors and practitioners around the country on the features and benefits of this prestigious credential. It is important to note the diplomate of the ACBN offers another unique benefit not mentioned by the members you've just heard from. That is the valuable access to the team of distinguished doctors that make up the ACBN. That cannot be overstated. They are all leaders in their respective disciplines, and they are who make the ACBN the important organization it is today. Thank you for watching and listening. If you are interested in pursuing the diplomate of the ACBN, make sure to visit our website at www.acbn.org and email our correspondence secretary, Bonnie Selak, at conacbn@chantel.net. Join us as we bring the absolute best care to our patients.